Hey, Kristina Bauer, welcome back to the Tick Bootcamp podcast.
Thanks so much for having me back. Love it.
Well, we really appreciate you coming back and meeting with us in a long form format. We were blessed to meet you down at the ILADS conference. I really enjoyed the interview with you. I know our audience, because we got a great deal of positive feedback, our audience really appreciated you. But I think we're better in a long form format. So I appreciated the sort of quick time we spent together, but that we were limited at ILADS to 15 minutes. And
Yeah.
we wanted to spend more time with you and learn more from you. I mean, you taught some really brilliant lessons, and you were kind enough to share a lot of your background with us last time. But we wanted to expand that, and unfortunately, Matt could not make it down to ILADS,
Yeah.
so. He really wanted to meet you as well. So this is
Oh,
important on a number of different levels. You need to meet the whole Tick Bootcamp crew, and we need to allow our audience to have a longer introduction to you and the great work that you're doing, not only as a coach, but also with the Texas Lyme Alliance.
sounds great. Thanks for having me back. Appreciate it.
All right. So, Kristina, it's a pleasure to have you on the podcast in our long form style, and also to share with everybody. You were on episode 512, which was the live interview from ILADS that Rich was referring to. And we're going to link to that in the show notes for anybody listening in case they want to tap through and go listen to that episode as well. And I just want to start with, so many people reach out to us all the time and say to us, why are you guys so positive? This is such a horrible disease and it's neglected and it's political. How do you guys have such a good attitude about Lyme disease in the future? And honestly, it's because of all of our interactions with people like you, Kristina, people who have been through it and have decided to get through the other side and now dedicate their lives to bettering the world when it comes to tick-borne illnesses. So all the work that you're doing through the Texas Lyme Alliance and all the people like you all around the world, you're the people that give us hope for the future. So I just want to say thank you for that, because we wouldn't be where we are today, and we're not going to be at a better place tomorrow if it weren't for all the work of people like you, Kristina. So thank you for that.
Yeah, that's a great opening. Thanks so much, you guys. You're very welcome. I'm honored to do the work and happy that I can. So glad to be back with you guys.
Yeah, so before we get into your amazing work that you're doing today to advocate and raise awareness, not only for the state of Texas, but everybody. I mean, Rich, met you and you're doing all kinds of work that's affecting people all around the world. Let's talk about your own personal experience with Lyme disease, which started at a very young age. So if you can start by just telling us what life was like as a kid and how Lyme touched you at such a young age.
Yeah. So I grew up in Midwestern Illinois, Central Illinois, and a lot of deer, a lot of deer ticks. But I was 8 years old, so 1980. Played in the woods a lot. We had some property in Missouri. Uh, of course, played in the woods a lot there too. But ran around a lot, did a lot of camping, hiking, splunking. Played every sport there was in grade school, and volleyball and basketball in high school early on. Just loved the outdoors, loved being athletic, and that's what led me eventually to opening a yoga spa here in Texas once we moved here. But yeah.
Got it. So talk to us about, Kristina, what life was like when you hit around 8 to 10 years old, because from what I understand, you were kind of living a healthy, normal life, but then you started to have these bouts of illness and you weren't like the other kids. So walk us through what that was like, in that, looking back, what your thoughts are now about your childhood and really what was going on deeper within your body as you were just constantly fighting these illnesses as a young child.
Yeah. So I was, well, getting a couple of ticks pulled off at a time, always on my head. So I was a very neurological patient. But playing in the creek out back of my house in Fairview Heights, Illinois, and which is down by St. Louis for anyone out there wondering. Um, and my mom would pull them off, of course, using a match usually, or, all the things that we know better now. She just didn't know. But, I would see her kind of looking at them a little bit, like, wonder if I should be doing anything with these, but there was just not enough information out back then. So within a few, weeks to months, so long ago when you're 8 to 10 years old to remember, timing of things. But my mom took me to my pediatrician who said I likely had junior pediatric arthritis. And then, that continued, all over pain and a lot of sinus infections, sinus trouble. And then about 13 got diagnosed with stomach ulcers. And then 19, no better. They continued to get worse until they started affecting my intestines, and then had a bowel obstruction that perforated through when I was 19 and almost killed me. Spent a few days in the hospital after emergency surgery, and unfortunately had to call my mom until I wasn't coming home for Mother's Day because of that reason. But it was hard going through grade school. There wasn't anything like gaslighting back then, but it was in real time a denial of symptoms by the medical community just because they didn't know. My pediatrician was wonderful. My mom tried her hardest, took me back multiple times. So, I think people tried, but everything was just so limited back then. And then I struggled a lot in high school with Epstein-Barr symptoms and strep throat a lot. My mom had to work 2 jobs to raise my sister and I. So I was alone a lot. And, nobody knew what was going on with my friends and stuff. So, my girlfriends would know, I would just come in and out of these sicknesses for a few days to, a week or two and go back to school. And then I was fine for months and very athletic. I was 7th grade and ran the 400 in 53 seconds, almost passing the women's world record by 1 second, almost tied. So, I was very athletic. I loved challenging myself. And I love what Dr. Bransfield says it perfectly. People who catch Lyme are lovers of life. And that's exactly how I would say it. I loved being in the doors. I still look in the woods and I just feel a calling. I love the water. I love the woods. I love animals. Anything to kind of be outdoors and Mother Nature just makes me feel good. So yeah, long story short, pretty normal until I, started having symptoms progressing into a multiple problem where people just were not knowing how to help me.
Right. And it wasn't permanent, right, Kristina? So it sounds like you're saying that you got sick for a few weeks with a sinus infection or something unknown, but then you'd bounce back and you go back to playing sports and living your life as, a high schooler. And then you get sick again, right? That's what I'm sensing, like this kind of back and forth of illness and then illness and well. And then what the heck is going on here? Why is she getting sick all the time, right?
Yeah, flu-like symptoms, just like, everybody has the same story or very similar. And it went on 30 years, misdiagnosed, and 16 doctors missed it. I was complaining about horrible pain. I remember leaving doctor's offices just in tears, sobbing kind of tears. Like I just was scooping myself off the floor to get back into my car. And, I didn't have anybody to help. And it was a very lonely, challenging time. Doctors were not helping. Then after my surgery, I was having appointments. Before my surgery, I was having appointments with, experts in St. Louis and, at the universities. And they still didn't understand. And they just kept maxing my doses of Azicol and prednisone, and when I'd have a flare, and it was just the worst ways of treating a situation with a symptomatic solution that just doesn't even touch the amount of pain that I was in, and the amount of medications I was taking was a lot.
So let's talk about that, Kristina, a little bit more, because many people can't relate to the severity of pain we go through when it comes to chronic Lyme disease. So can you be a little bit more specific about where you felt the pain, what it was like, and how crippling it really was for you?
Well, it didn't start getting really crippling until after I had kids. So the amount of pain, it was severe, even in grade school, high school, and then college was difficult. I was working full time. I was a formal bar supervisor and bartender, and at a private country club. So it was like beautiful because I had a family. I felt very supported and loved, and these families were just so amazing. Shout out to Sunset Hills Country Club in Edwardsville, Illinois. They were wonderful to me. Um, and I was able to go to college in the backyard, basically, big open Southern Illinois University in Edwardsville. The country club backs up to that property. So it was amazing. I would go to classes all day, and then I'd go take a nap in the ladies' lounge and then start work and clock in. But I was able to do my homework sitting up there, because in the formal, it wouldn't get busy until holidays or, pre-dinner. And then every once in a while, you'd have some people come over after dinner. So it really was wonderful to allow me to be able to have a low-key life that sponsored the ability to get me through college. It was difficult. I almost didn't get out because I missed a lot. And it did take me a while. The first time I tried it, I had to drop. But then I went back, for all you kids out there, and was able to get through normal, 4.5 years, and worked through summers at school and stuff, and was able to really, advocate for myself to get the rest and the care that I needed. And then after I had stomach surgery, I wanted to mention on camera that after I had my stomach surgery, I was quoted before the Affordable Care Act. I was quoted $432 a month at 19 years old from Blue Cross Blue Shield for health insurance. And I just lost my mind. I was like,
What were
how?
your diagnoses at that point? Did you have any misdiagnoses on your chart that were
Of
causing
course.
those rates to be so high?
No, it was because I had a pre-existing illness and had stomach surgery. So Crohn's disease at that point was, and ulcers, history of ulcers, stomach ulcers, was the only thing on my chart, because, they don't back then follow your medical history like they do now, and it's all digital and easy to access. But that's it. It was because I had just had stomach surgery is why. It wasn't just any stomach surgery. If you're not familiar with an obstruction that perforates through, that will kill you quickly. Your intestines are separated. So,
Wow.
uh, and I had pretty severe flu-like symptoms before that happened. Um, so yeah, when you work at a large, facility or in a group plan, you can get that coverage without questions asked to cover pre-existing illness. And I had full life insurance, both paid by the company I worked for, the country club. So it was really amazing. I had to do a lot of research to figure this out, and it just, God has a way. So
Yeah, and the fact that you were able to get through all of this despite being sick. I mean, you were bit as a child, 8 years old. You were sick throughout high school. Now you're getting through college, and it sounds like after college is when it became extremely debilitating and crippling. So why do you think your body was, well, I guess the better question to ask is, sometimes we hear people get sick and they become immediately unwell, right? And it could just be the amount of pathogens. It could be multiple co-infections. It could be different strains of bacteria. It could be pre-existing conditions. It could be genetic. There's a lot of factors. But why do you think you in particular took so long to get that unwell? And your body was fighting it clearly, because you'd be sick, you get better. Your immune system would kind of win a little bit. Then you get sick again, right? Why do you think you were so healthy for so long to fight it off until you weren't, right? Was your diet on point? Were you exercising? Was your mental health good, and your lifestyle good? And what are the things that you were doing that allowed you to push back and fight back Lyme for so long?
Well, I've always been a big exerciser. I was, doing kickboxing and all kinds of things, I just enjoy that kind of stuff. And, but I was that sick. It wasn't like, all of a sudden it progressed into, of course, we'll get to.
Yeah, so I maybe and it sounds like because you're so strong, you're making it like you weren't as sick as you were, but you're telling us that you were very sick. So just give us an idea then, because I definitely misunderstood that, how sick you truly were throughout college, because it sounds like you were that bad.
Yeah. So, it did progress into a disabled state on and off after having kids, but I was able to barely get through college. Like, I was barely able to get through high school, and grade school I was doing a little bit better, but because of course dissemination scientifically, it continued to spread, affect my central nervous system, my brain. If I'd have had treatment early on, throwing the audience a softball, of course my prognosis would have been much better, and remission shorter, reached shorter. But I attribute it to mindset. I've always tried to be a very positive person, a persevering person. Coming from where I came from, you had to have resiliency. It just is how it was. My parents parted in when I was right around 10 years old. So I started working early on in the 5th grade, cleaning houses for my teacher. And she just mothered me. And really, the support of my community throughout my life, on and off, has been a heaven sent situation that I needed. God just puts it in your way. And, yeah, after kids, I didn't, of course, realize I had Lyme disease. I knew something was very wrong, but everyone kept telling me I was fine. You're the healthiest sick person I've ever seen. You look great on paper, but I clearly see you are very sick. Low blood pressure, dangerously low blood pressure, but yet they would not say a word and let you drive home. Even with kids, you just, I was not knowing any better, doing the very best I could to get through these situations. And then that might be a good stopping point with, exercise, I think, is the short answer. And doing things to improve mental health, being outdoors, Mother Nature, animals,
Yeah.
things like that.
That makes a lot of sense, and you definitely answered both questions, so thank you.
Good.
Now, as a follow-up to that, let's talk about two things that are happening in the background, right, as you're growing up. What impact did your health have on your relationship with your family? Specifically, sounds like your parents split at a young age, with your parents, and also, did you have any siblings? That's the first question I have for you.
Yeah. So, my mom, like I said, did as much as she could and was a good advocate for me. Definitely did her best to, care for me, but she just couldn't take off work. So it was difficult on both of us, but, she would try to set me up before she'd go to work with drinks and stuff like that on the couch and TV and whatnot. So it was difficult for her to watch. My siblings, were off doing their stuff. My sister's 2 years older than me. My brother's 4 years older than me. We had mold in our house growing up, a lot of it. My sister ended up with breast cancer, which she's an ED, but I would consider that chronic illness. And used to sleep down in the basement where I was upstairs, so probably had something to do with my delay in severity, where hers, she did okay and then took a nosedive. Gosh, it's been probably 10 years now that she treated breast cancer successfully. but you know, I think that's um I'm not sure if I answered your question,
No,
but
you did. And I guess that did your illness though cause any resentment? Because sometimes we hear people tell us my relationship with my siblings was strained because I got more attention because I was the sick one, or
yeah.
my parents ended up fighting because of it, and it was hard on me, and it made me even more sick because I felt like I was the root. So I guess what I'm asking is there any strain or any kind of
Yeah.
complexities around your family relationship because your health was so poor as you were growing up?
Yeah, no, I definitely was, I guess, considered the drama queen because of it, and people didn't understand. I still advocate for mental health um, because of this reason. I feel like if you talk about it, people can't throw you under the bus about it. And um, yeah, a strain for sure, but unrecognized suffering for sure. Just my brother definitely just ignored everything. And then out of the blue, like 6 years ago, he writes a post out of the blue on Facebook and says, "My sisters are sick." I was like, ugh, I don't hear from you when I am suffering. And now that I'm in remission, he wants to announce, I was like, oh my gosh. So it was a very nice sentiment, but, I just let everybody know we were good. My sister was in ED at that time, 5 years passed at that point, and I had already been doing much better. But so I think that's kind of um, he didn't understand kind of how to deal with things, and being an older brother and a guy.
Yeah.
But my sister, I think probably was some um, jealousy and issues there because of, I don't know, we all kind of got the same attention back then because it a person who works that much only has so much time for what's going on between animals and kids. So yeah, probably a little bit of jealousy of getting some more
Yeah.
time and attention.
Let's touch on, you talked about the mental health component of it, right? And I think so many people in the Lyme community are afraid to touch on that because they don't want to be perceived as being crazy or all in their head. But we know that mental health is a huge impact and a huge symptom of any chronic illness, right? You'd be silly to think that you can be chronically ill and not have any kind of mental health impacts, whether it's just depression or sadness or
Yeah.
anxiety, which we know is a direct symptom of Lyme disease. So how was your mental health at the time when you were getting sicker, let's say in high school and in college when you were still young?
Um, I had a lot of friends from all walks of life. I was very social. Um, of course, I was able to do more actively when I was well. And so I always had an underlying um, bit of depression that I was in denial about, for sure. Um, and after my parents got divorced, I remember my mom got me a counselor for the first time. I believe I was 13. And then, ironically, uh, that was a short-lived situation. But I appreciated it. Kind of got me understanding how beneficial it could be later on in life. But, a little bit of depression, but anxiety. And then after things started progressing, I wasn't getting any better. I remember my mom took me to a dermatologist, and they put me on tetracycline when I was 13 for acne, and it knocked my socks off. I remember being on my knees in child's pose, and I would just sob and not understand, like, what the heck is happening to me? Why do I feel like this? This feels terrible. And nobody understood what was going on. My, sister was working by then, 15, 16, and it was just her and my mom that I lived with. And So my aunt and uncle every once in a while would come over and check on me. They knew I was alone a lot and take me in their convertible, and I'd stay for days at their house. So, it was kind of not recognized that I was treating Lyme disease at 13 years old by way of treating acne through a dermatologist until I interviewed through my advocacy work with Texas Lyme Alliance Dr. Rosalie Greenberg, whom I adore. And she said, "You were herxing because you were treating Lyme disease and didn't know it." And I was like, so when I encourage people to advocate and show up for themselves, they're showing up for everybody else who doesn't know, because just my sharing that story may fall in the ears of a dermatologist who sees this happening, or a parent who sees this happening. Of course, we don't use tetracycline anymore, but that's what we used back then. My teeth are fine, but it's just so tricky going through the complexities of not understanding, why do I feel so awful? The psychological symptoms were severe. My mood swings, I just had no idea. I was 13, 14 years old, alone, and nobody knew. So it was hard, but kind of funny to find out 20 years later. Or
Yeah,
longer, actually.
and Kristina, I can't thank you enough for sharing that experience, because it's so true. There are so many signs, and in doing over 500 interviews and speaking to thousands of people, and we've had Dr. Greenberg on the podcast several times. We absolutely love her as well. She's brilliant, right? But we identify patterns like the one you just described, and then we identify them and ask people, and then we also discuss them with doctors and researchers. And these are patterns that I wish more doctors understood. Because when somebody's treating acne with doxycycline or any kind of antibiotic, they start having these Herxheimer-based reactions where they're treating the Lyme and they're having this atypical response to the antibiotic, the doctor prescribing it for a different use case should be thinking, why is that happening? And in many cases, it could be from treating the Lyme. It could be, it could be a Herx. It could be a variety of things from it. But we need to raise awareness, especially in the medical community, which is why iLads is so critical, to help people be able to get to shorter diagnoses through other doctors making observation like you just described, because you would have had a diagnosis potentially in your teens if that were picked up by your dermatologist, right? So that's where I feel like this advocacy work is so critical to continue to push forward with people understanding these types of things. So what I also want to touch on is, because we know Lyme can impact romantic relationships as well. Not only family, not only personal, but romantic relationships. So you mentioned that you, despite not having a diagnosis and despite being so sick, you had children. So walk us through your if you're comfortable, not to put you on the spot, but what it was like to date and then eventually have children while being so sick.
Well, I didn't know I was sick. I knew I was sick, but no one was admitting I was sick. So you carry on like normal. You carry on like normal. I knew from a young age that I was a girl who sometimes needed to be on a liquid diet with some green powder. And that was it, which was heavy spirulina. And like, I've always been big into health and wellness before it was cool, right? This is the 80s, 90s, early 90s. And so I remember one time, dating my husband at the time, we went for ice cream, and I just was too embarrassed to say anything, because back then I was even dairy free at, I guess I was 25. I met him at 26. I was 26. And, we're all standing in like this long line, and we get up there and I was like, nope, I'm good. Just wanted to be here. And I didn't even get a soda because, sugar didn't make me feel well. So, it's some awkward times like that, my stepmom kind of called me out, like, huh? Kind of poked at me a little bit, like, So, people just don't understand. And so it makes it difficult, makes dating difficult. It makes things very embarrassing a lot of times. Um, for people to hear that I had Crohn's disease, I was like, the only symptoms really that I had were stomach, intestinal ulcers. And when I was flaring, of course, I'd be just, uncomfortable and inconvenienced. But I did not have traditional Crohn's symptoms. So I kept telling them, like, this doesn't sound right, doesn't feel right. So it made relationships and dating difficult. And then, of course, having kids, um, I gave it at least a year to be off of birth control pills and smoking cigarettes and, all the things. And so I wanted to be as healthy as possible, probably knowing in the back of my subconscious mind that I don't do well when I don't take care of myself, when I don't rest. That is the number one way to um, go south and not, be able to function very well for a few days to a few weeks. So, planning a family, after that, ended up giving to all four of my kids, in which I had, some non-traditional crashing after giving birth, which is very typical. Um, One of our board members is Dr. Ron Wilson, who was my first Lyme doctor, and he was an OB-GYN for 30 years and delivered 5,000 babies, and said that he would see typically moms who had Lyme disease crash after they gave birth, which we now know, and which I personally attribute that to what people call postpartum blues, crushing fatigue, and depression. That's not normal. When you have hormonal swings, that's normal. But any mom or new mom out there that has crushing fatigue after birth, not normal. Go to the doctor, get the right test. Go to the right doctor, a qualified doctor, not just any doctor. And depression, uh, anxiety can turn severe and be dangerous for people and newborn babies. And that's something that a lot of people aren't willing to talk about. But I truly believe that a lot of these things that go by the wayside are attributed to a high percentage of positive ticks in Illinois and Texas. Those are the two states I advocate for, but as we all know, they're been found in all 50 states. But my kids then suffered quite a bit as well. And this could have all been, of course, avoided very easily, and don't hurt me, across Zoom, but cheaply.
Well, no, but we agree. So, all right, we'll get to so many things I want to dive deeper into, especially your children. But before we do that, we've had people talk about congenital Lyme and also what it's like to have children with Lyme disease. Now, we know many people who have had Lyme, had a diagnosis, treated, got into a good state, regained their health, and have had children without any kind of consequences on their health and also their children's health. And they manage their children, they test them, and the children, turn out really well. So we are firm believers, understanding science is still limited in a lot of areas in this area, that if you get yourself treated into a good place in a good state of health, you can have a healthy pregnancy and your children can and will be safe and most likely not impacted and, take on the disease, right? Now, in your case, and that's why it's going to be twofold. I want to focus on the first part because it sounds like you're very passionate about this topic, and we haven't had people do a super deep dive to explain the differences here. So I want to make sure we spend an appropriate amount of time to go over this.
Okay.
Is that okay with you?
Yeah, I know, that's great. I love it. Yeah.
So when we talk about postpartum versus, we'll call it post-pregnancy Lyme flare, right? I don't know what else to call it. Is there a name you call that? Is that an okay term to use? Or should I say something else? Okay.
I don't know what else to call it. Yeah, I would call it postpartum blues.
Okay.
Attributed from potential misdiagnosed infections.
Got it. So let's describe. No, it's good though. No, but so there's really two buckets, right? But you said there's a hormonal swing, which is significantly different than what you experience. So let's first define what the hormonal swings in traditional postpartum is, which is different. What does that look like? Can you just describe that a little bit better so
Oh,
we can
yeah.
identify that bucket first?
Yeah. Okay. So this is a big topic, so you may need to keep me on track.
Sure.
I tend to get a lot of thoughts going at once. So, first thing is hormonal swing would be this may be a little graphic for you and your listeners, but there's a lot of moms out there who need a big sister, so I'm talking to you.
Yeah, Kristina, there's no such thing as TMI or too much information. Rich and I
Okay.
have heard it all, so don't hold back, please.
Okay.
Let us say everything.
All right. So, hormonal swing when you're nursing, you first of all, you increase so many hormones that you get cramps when you're nursing after you give birth. Um, it's the quickest way to get your uterus back on track. So I'm a huge fan of nursing babies. There's some controversy in passing on infection through lactation if it's just not been studied.
What are your views, Kristina, there? And that's strictly if you have an active infection, I think, right?
Exactly. Yeah. So if a mom gets bit after she gives birth and is nursing is a variable. And then if, of course, she already is infected, treats, or doesn't treat.
Yep.
It is infected. So there's so many variables. So this topic, my brain just kind of.
But right, but in that bucket though, Kristina, if somebody had Lyme, treated, had a baby, and then breastfeeds, do you think that that's a safe thing to do because the infection has been treated? That's the first scenario I think you described, right? What are your views in that scenario?
Well, first off, I would still nurse if it was, I can speak about my experience. I don't want anybody to think I'm giving medical advice or anything like that. But first things first is the baby needs a colostrum for its immune system. Vaginal birth and colostrum, that's the best case scenario. A lot of times this just isn't possible. And I would never want a mom out there to feel badly if she can't do either of those because we are all different. So self-advocacy is big there. However, we don't know if it's passed in the breast milk, if there is chaffing lesions. Those are very common when you're a new mom nursing. It hurts. So there may be some blood in the breast milk because of that. There are so many variables. That is a possibility. Needs studied out there. Contact Texas Lyme Alliance. I love any of these kind of studies. I'm willing to do them. The other is we were talking mostly along the lines of hormonal shifts and swings. And, I think that, it releases Pitocin and some feel-good natural chemicals that bond with the baby. There's so many good, healthy reasons why for mental health and hormone shifts, it's important to consider nursing. But, I want to touch on the most important thing to me in this conversation right now is to make sure you are set up ahead of time with a cord blood test. I know IGeneX has a good one, but people should research this with their Lyme doctor, a qualified Lyme doctor, and order the test, have it ready. The people need to be trained, the doctor, the nurses, everybody involved on how to do this. Of course, using the proper protocols laid out by the lab. I've just having Dr. Wilson on my board, who is an former OB-GYN turned Lyme doctor, really helped propel my knowledge in this area coming from him. And then we also wrote a gestational Lyme paper that's on, he wrote it, excuse me, and I edited it. But I made sure that he found it as important as I did to cite everything he said because I am CDC positive and Digenix positive. So I like to advocate because naysayers can't push me down. So if I didn't give it to my kids, which is the conspiracy and the second important thing here, then when I treated my children for Lyme disease who have never had a tick bite, why did they heal?
Right. But also, Kristina, follow-up question to that, which is, I just want to make sure I understand the cord blood test is essentially you're testing your child for Lyme disease through an Igenic specialized test or an equivalent specialized test to determine if your child was born with Lyme disease. Is that what that means? I just want to make sure I understand what you're saying.
Exactly. Yeah.
Okay.
Thanks for, yeah.
So you recommend people do that because that can be definitive proof that, I mean, granted, the CDC has recognized that congenital Lyme is real, and they even acknowledge it on their website. I think, a couple of years ago, I think they did that, right? You probably know better than us, Kristina, in that regard, which is huge. That was a nice milestone we hit.
Wow.
But there still is a lot of controversy and drama around it. So the more evidence we can have, the better, I think is what you're saying. So I do want to go back to that topic, but I just want to close the loop on the postpartum symptoms in the mother, because obviously the hormonal swings is one thing. You were saying, it's one thing to be hormonal where you have ups and downs,
Yeah.
but that's different. And that's not really Lyme related postpartum. That's
Right.
potentially normal postpartum with
Yeah.
hormonal
Yeah.
shifts based on the way our bodies are built to develop that bond with the child and to help the mother have the hormones they need to be successful, right? In motherhood, whatever. But I think what you're saying is that the postpartum Lyme experience is essentially chronic fatigue. You're sleeping all the time, your body hurts, you're tired all the time, you have brain fog, you have potential depression and anxiety, but more consistent, which is different than what you just described in that previous bucket, which was more of just hormonal shifts and ups and downs. Is that a fair assessment, or am I
The difference
off?
is exactly what I said previously is crushing fatigue and severe depression, maybe even severe anxiety to the point of panic attacks may be a part of this situation, and potential suicide attempts. This is a very serious topic that deserves which you're doing such a great job in allowing me to highlight it, but I do appreciate you separating them out so that we allow our audience to hear this clearly. There is a huge difference, and it can very easily be misinterpreted as postpartum depression. I think we need to get rid of that. It's terrible. Any kind of syndrome or, anything that doesn't say how to treat it and what it is at its root, it needs to be abolished, the term. And
Meaning we got to get deeper. We got to get to the root, right? What's causing this? Is it a Lyme infection? Is it another infection? Is it a hormone imbalance? What is it? Instead of calling it a syndrome and just living with it, we got to get deeper. We got to get to the root cause. I'm with you.
Yeah, because a little bit of depression is normal when you're not sleeping well, when you're tired, and your nursing takes a lot out of a young mom or older mom like the rest of us. I still have a 15-year-old. I'm 52. But it's very different. I had 4 children within 6 years from 31 to 37, and I was considered a geriatric mom, right? But it doesn't matter what your age is when you give birth, mothers out there. It matters how your health is before you go in. And everyone before family planning should note, get tested for this stuff. Treat yourself better than your veterinarian treats your dog. They get tested every single year without question. It is part of the protocol. Every well check I take my dogs. We have to beg for tests. Then when we do, they gaslight us and say there's no Lyme in fill in the blank state. Then they use a test that is known to fail up to 67% of the time. It's a crappy test. And then when, or if I should say, they do know what labs are highly sensitive to tick-borne illness, they don't know how to read it. They don't know to take Dr. Wilson says, a thorough health history, including the mother of the potential baby. So it's a very entailed thing. It's a 2-hour appointment. It's no 15 minutes. Can use insurance. Patients are always, we need insurance coverage. And I don't want to get off on a tangent, but that is something that desperately needs discussed as well. But yeah, then they need to follow the kids. I was looking down a second ago because I wanted to pull this up for you. Right now, we're partnering and advocating with Lyme in Pregnancy Research study from Children's National. Everyone needs to know that this is going on. Any pregnant people out there or grandparents, if you have had a kiddo or you yourself have had on and off undiagnosed illnesses, you need tested for tick-borne illness. This website is https:// lymeandpregnancyresearch.com / and that is a paid study. If you're pregnant, Dr. Mulkey is fantastic and is head of that program, Research, Education, and Innovation Week, and Staying Safe While Pregnant from Tick-Borne Illness. They have an Instagram page that everyone should follow. And do this study, guys. Anybody out there that knows a pregnant person out there, we need this study big time.
So I'm going to drop the link. Kristina, I'm going to drop the link to that website in the show notes so people can just click on the link to launch the website, the Lyme Disease and Pregnancy Research. But just to be clear, this research study is specifically for people that are currently pregnant who have had unknown, bizarre health issues that might be Lyme or a known Lyme infection. Is that true?
It's pregnant people with Lyme.
Oh, with Lyme. Okay.
Need to know that they, either clinically diagnosed, I believe, is fine as well.
Okay.
As positive test.
Got it. So, it's so interesting to hear all this because, I mean, obviously you are a leader in this space. I mean, in everything Lyme disease, but specifically this niche topic as well. And we see this, we've had people tell us about the homeless community. How many homeless people are suffering from Lyme disease causing mental health issues because they're living in the woods? And, you start to think and go, oh my goodness, what percentage of that population is suffering from a tick-borne illness? Now you're opening up our eyes to the new mother community. How many people were managing Lyme like yourself, right? And then get even sicker because of the stress of motherhood and because of the emotional toll of motherhood and the physical toll on your body and just all of that, right? So that's a whole other area where we might have suffering new moms who should be aware of Lyme disease as a potential root to their issues, not just postpartum, which to your point is a syndrome that really lacks a root, right? So I think that's another important niche area to look at. I mean, so the list goes on and on and on about how, hunters, et cetera, but we really got to bring attention to these groups of people so they're aware of these things so we can prevent prolonged suffering like we had to go through. So I'm really happy that you're sharing this because we don't talk about this topic often on the podcast, and I'm glad we did this deep dive. So that's really helpful. Is there anything else that you want to share as far as correlating those two buckets before we move on a little bit with your diagnosis and your children as well, about specifically the differences between, we'll call it the postpartum Lyme symptoms versus the postpartum normal symptoms? You know what I mean? To kind of call out those buckets so people listening can be aware of those differences and then bring it to their doctors if necessary.
Well, all the dads out there, moms, send this to them. Moms need help. Change those diapers. Don't leave it up to the mom. Get up for those feedings. Help. Moms need support. It is very difficult. It's a very natural thing. Like, I didn't struggle having kids. I loved being pregnant. But the lack of energy as a new parent altogether. Grandparents, help your sons and daughters if they have new babies. But people need to be aware that there is a big difference between the level of support a mom who has crushing fatigue and you notice they're not bathing normally as they would all their lives, are depressed or change in eating habits, change in anxiety, constant doing things that are, maybe more OCD or, different psychological traits. People who spend time with other people recognize those and do not ignore them, because it can get serious if it's not already and you just don't know it. So be around new moms and dads and be aware that this can be a potential life-threatening situation and safety issue. Lyme rage is very difficult to get through as a young mom or kid. That's another whole psychiatric issue to talk about that was highlighted in the Monsters Inside Me documentary that doesn't get a lot of attention. And we just showed that here in our end of our closing out of our Lyme Awareness Month here in Texas. And we had Tony Silva on for Q&A, and he said that, been asking him to do a congenital Lyme follow-up, talking about all the ways of transmission outside of just, oh, I have symptoms and look how hard it is. Fabulous documentaries have come out, 3, I think, over or more actually, maybe 4, over the last year and a half, 2 years. So very compelling stories for people to learn from. But as Frances in the Monster Inside Me Lyme documentary is visiting her mom's gravesite, he said in our recent Q&A that that is where she starts to begin to wonder if she was in fact congenitally infected as well. And her mom ended up passing away at 52 years old, my age right now, with organ failure. Like, guys, wow. I mean, the amount of suffering that these people are going through at such a young age, like all along, maybe, like I went 30 years. It's ridiculous. These cases are so normal. I hear them all the time. Generational, I call it generational Lyme families. And people who go on longer than me getting misdiagnosed, 30, 40, 50 years and on, it's just awful, the amount of suffering that has to happen. So you mentioned earlier the level of pain, and I don't think I touched on that well enough. So I'll just mention here, if that's okay.
Please do. Yes.
I, at one point when I was treating, so maybe I got diagnosed in 2012. I got my port in 2013 and out in 2014. So 2013-ish, end of that year, I remember I was going to do a little self-inventory, I would call it, as a former yoga instructor, right? I guess you never stop being a yoga instructor in your mind. But I counted 8 different areas of pain sources. I stood in my bedroom. I remember I had the energy to get dressed that day and run my kids to school and stuff. 8 different. So, that was, if I remember correctly, my sinuses were on fire, full body fibromyalgia pain, joint pain, headache. Oh my gosh, so many issues. I don't even want to go there. But yeah, the suffering is real. So
So,
can I answer?
Kristina, I wanted to join the conversation. I mean, you and Matt are doing a great job together, but I just Matt is suggesting that there may be 2 buckets. A bucket of people who are suffering from the challenges that the hormonal changes of pregnancy and post-pregnancy bring along versus the challenges that Lyme may be creating for a mother, whether it be during the pregnancy or postpartum. But my understanding, and I want to contribute a couple of things. I had a case as a young lawyer where a woman who shortly after giving birth had become very aggressive and violent, and she actually attacked a couple of people who she was very close with, and she was arrested for that. And I had to hire an expert on postpartum stress disorder and postpartum
Oh,
depression.
wow. Interesting.
And what I learned from that expert years ago was that the process of the process in some cases is you have a person who has a normal pregnancy, and what's happening is as time goes on, hormonal levels increase, and then they increase, and they increase, and what's happening on a regular basis is that the hormonal levels for 9 months are increasing, and they get to a peak just before the baby's born. And then generally what happens with most women is there's a slow decline of the hormonal levels after the baby is born.
Yeah.
But in some cases, what's happening is there's a hormonal crash. They go from very high and all the way back down to their pre-pregnancy hormonal levels. And those are the cases where you have, in some cases, aggression and violence and other types of unexpected responses, right? So I think it's important to understand that there is that one bucket that Matt was just defining where someone has a less than optimal decline in hormonal levels after the birth of the baby, and that causes challenges, right? Now we
Yeah.
have this other bucket that Matt was defining, which is somebody who has a Lyme infection, or they had a Lyme infection that's been reactivated as a result of the changes in the immune system of the pregnant mother. And we know there are changes in the immune system because this foreign body is now growing inside the mother, and the immune system has to change so that this foreign body is not going to be rejected. It could be an event that results in the triggering of Lyme disease. Now, that would be another bucket. But I think there another thing that has to be explored, and I know thankfully people like you, Kristina, are triggering research and fostering research. But there's another place here, and the other place is we can have someone who is pregnant. They're having this normal increase in hormonal levels, and then the Lyme disease is causing a change in what would be a normal decline in Lyme in hormonal levels, right? Because we know that Lyme does cause hormonal changes. We know that the HPA axis is not going to function normally when somebody has Lyme disease. We understand that there's going to be an injection of stress hormones that are coming from the disease itself, as well as the challenges of being treated. So we actually have this third bucket where we have somebody who is not having a traditional or an optimal declination in hormonal levels because of the impact that the Lyme infection is having on their experience. So I think there is just so much here that has to be explored, and I just wanted to highlight those three pieces and just share my experiences with with having interviewed that expert years ago on postpartum stress disorder, and how there really is so much that has to be looked at here, so that we can properly identify these challenges and try to protect women, mothers, and the people that they love that they're with from from the potential the challenges that can come with this, which unfortunately can include violence.
Yeah, that's an amazing story. So thank you for touching on that, because so many things came to mind. You hear all the time about moms killing their kids or killing their babies, and you just don't know what's going through somebody's head. But I so appreciate you bringing that up, because Dr. Bransfield has done a lot of research around this topic, and brain inflammation is huge part of undiagnosed infections, we'll call it, because now we also have COVID long haulers along with Lyme long haulers, so that we can associate in our heads, mentioning those two things side by side.
Which is all immune dysfunction, right, Kristina? I mean, it's immune dysfunction triggered by one type of infection or another.
So, in particular, though, high cytokines and brain inflammation hinders the ability to use good judgment. Some people can even hallucinate. One lady, I won't mention the details, but it's gory and graphic, heard voices telling her to do something to her baby, that eventually killed it. But horrific things could be avoided if we have, for instance, in the state of Texas, out of a small sample size of ticks that were collected in the southern region of the Texas-Mexico border in 2016, Texas A&M Vet Medicine researched this to find that 45% of those ticks were infected with Lyme disease, of the Ixodes scapularii, the deer ticks, and out of 1,238 collected, 109 were infected. So if we have 45%, of a small number, 9 years ago, and now ticks are having thousands of babies, whether that's, been proven through Chris Newby's research in the book Bitten, hint, hint, audience, go read that, then the proliferation of suffering is exponential, since they're having more babies. Neighborhoods are getting developed and pushing, forward species that migrate with ticks. People move with infections. A lot more people are suffering these days with all of these things that could be avoided with domestic violence, child abuse, and homicidality and suicidality. So Dr. Bransfield's research is really cutting edge. It was just, more was shared recently about it, but I wanted to just touch on Bartonella being undiagnosed as traditionally the the psychological illness of rage, I think, that was highlighted in The Monsters Inside Me, called Lyme Rage, and one of the screens flashed big letters when Frances was really freaking out, having severe panic attacks and couldn't handle stress, and people just talking was, irritating, and she was having a hard time. A lot of these things are very simply just need to be tested properly and treated properly. I would say it could be fair, maybe 45% of domestic violence and homicidality and suicidality of people who commit these crimes should all be tested. But would 45% of these people test positive for something that could have been avoided? And then who is to blame? I don't go down those holes, because I really try to stay in the solution and provide leadership in that way to, not get into everybody needs to go to jail. I don't disagree with these things, but
but Kristina, I think you're raising an interesting point that we've at times tried to deal with here at Tick Boot Camp, and we're always careful when we broach these topics, because they're very triggering to many people.
Yeah, that's right.
And I can tell you that I had created a post regarding Luigi Mangione, who assassinated someone on the streets of New York. I don't think there's any debate about it, but
Right.
I wanted to raise the issue as part of that national conversation about whether or not he had an active infection or was suffering from post-treatment Lyme symptoms, because he had Lyme disease. That's been well established. And if you read any of what he had written during the course of the times that he was having conversations with people regarding Lyme disease, he sounded very much like many of the people that we've interviewed on this podcast. But as soon as I brought that up, I was attacked almost uniformly. It becomes very triggering, and I was accused of trying to turn him into the face of Lyme disease, and that was something people didn't want to happen. So,
Right.
the conversation that you're broaching, which is, I think, even more triggering because we're also talking about not only violence the way he was violent to a third party, but interfamily violence, whether it be domestic violence, violence towards children, violence towards partners. That's even more triggering. But it is real, and it's something that we do have to explore. I think on two fronts. The first front we have to explore it on is Lyme disease is a disease of exposure. And with proper training and
Right.
education, you have a very good chance of protecting yourself from suffering from Lyme disease, right? But the secondary part of it is if we're going to have a just criminal justice system, then we do have to take into consideration all the factors that resulted in an event, and take that in consideration when we're sentencing someone because
Absolutely. They need tested. Every one of
yeah.
them.
So testing, and of course you did also point out that the testing does need to be improved. So we certainly have to have a lot more research on congenital Lyme disease.
Yeah.
I do want to highlight something else that you brought up that we had never discussed on this podcast, at least to my knowledge. So I do appreciate it, and I do want to highlight it is
Yeah.
that congenital Lyme is not just a disease that an infant can contract in utero, and I think the research has probably definitively established that the Lyme bacteria can pass through the placenta and can infect a child.
Of course.
And we have touched on the possibility of Lyme disease being contracted by an infant from breastfeeding as a result of from breast milk, and maybe the colostrum. I don't know if there's any research on that,
I
but
don't know yet.
that's
Yeah.
certainly,
Not been
something
studied.
to look at. But we certainly do know that women with Lyme disease, when their breast milk is tested, they do have the bacteria in the breast milk. We know that that's established as well. I think that's been proven as well. What you discussed, which is another interesting piece that I want to explore a little bit more with you, which is the lesions, the breastfeeding lesions, which I never thought of, even though I'm a father of 4 children, all of whom
Yeah.
breastfed. I really never thought about that as a possibility of an even
Of
greater
course.
risk of infection, because we know very clearly. We certainly hear where Matt and I live on Long Island, where you're not allowed to give blood. If you've ever had, for example, a Bartonella diagnosis
Good.
or a Babesia diagnosis, right? So we do know that definitively, blood to blood transmission
Right.
is going to be a um, vehicle for Lyme transmission. So
Yeah.
so I think mothers have a lot to think about and a lot to discuss with their doctors. And I want to thank you for highlighting a couple of things that are important, which is that if you are a Lyme patient and you are pregnant and your child is born, part of what you have to discuss with your OBGYN and your pediatrician is whether or not breastfeeding is wise. And are
Yeah.
there, or maybe if breastfeeding is wise, maybe it's pumping and not direct breastfeeding. And I mean, I think there are a lot of different options here that I certainly wasn't aware of, and we hadn't discussed on this podcast that you've now brought up, so that maybe we can reduce the likelihood of transmission, even though the doctors with the patient come to the conclusion that breastfeeding is appropriate, but maybe not direct breastfeeding. Maybe it is through pumping. Maybe breastfeeding isn't appropriate in cases where we have folks who are dealing with Lyme disease, and they want to have a reduced likelihood of transmission. So there are a lot of things you brought up here, and I just wanted to highlight them.
Yeah.
I thought it was just fantastic, and
Thank you.
hopefully there can be more research on these different topics and these
Absolutely.
different vehicles for transmitting Lyme from mother to child, more than just in utero.
Yeah. Thanks for all that. I wanted to mention two things I wrote down as um, we have been communicating back and forth that came up that I don't want to fail to mention is Lyme disease is sexually transmitted. So if mom treats, has a baby, starts nursing, has intercourse with dad, and dad's untested and treated, okay? So we have that situation. And then also I want to mention, so I don't want to just let that fall off a cliff. I'm sorry for that. What's important there is both intimate partners need tested and treated properly with qualified tests, qualified doctors. Qualified meaning people who have gone through ILADS training, who are aware of IDSA guidelines, but incorporate that integrative care from ILADS. You cannot just treat based off one protocol. And something else to touch on with treatment, because I know we could talk for hours and hours, but very important. The one-stop shop for a new bite of doxycycline is hogwash. And what I mean by that is one bite of a tick can contain 19 different pathogens, and each of them can have up to 100 strains. Those pathogens include things like viruses and parasites and mycoplasma pneumonia. And so the one-stop treatment of doxycycline is hogwash, because these people are truly ignoring the complexity. That is no cure for Lyme disease. To catch it early with doxycycline as a one-stop shop treatment is hogwash. And even the best of the best need to know that unless you know.
So Kristina, can we build that out a little bit? Because when we're talking about one stop shop, do you mean one dose of doxy, or do you mean just using doxy, even if it's for the ILADS recommended window of time, which is certainly not one dose and is certainly not one short period of
6 to
time.
8 weeks, I think, is what's normal. But most of them that are trained through ILADS, I have not taken the training, so I can't tell you exactly, but are well aware of what pathogens are passed along traditional tick bites. But yeah, everybody needs to be aware that this isn't just doxy. It's not just one dose. It's not just 6 to 8 weeks of doxy. People need to understand that viruses and parasites also need to be tested and treated.
Right. So, and let me share one more thing with our audience, just to add to what you just shared, which is there are so far 19 pathogens that have been identified that can be transmitted through a tick bite. But that's all that has been identified. And I think one of the things the three of us have all agreed is that we're at the very early stages of having competent research. And there actually have been some studies that demonstrate that a tick can harbor up to 200 different pathogens.
Oh,
And
yeah.
can spit substantially more than 19 that we've identified thus far. And Lyme disease is more frequently becoming a polymicrobial infection. I think it probably always was, but certainly I think we're getting to a point where we're generally accepting that Lyme disease is polymicrobial. It is not going to be a single microbe. And I can share with you just, in the last couple of years, I mean, we've been doing this podcast close to 5 years now. And we've interviewed hundreds of professionals and professional people, either because they had Lyme disease themselves, or experts because they went on a Lyme journey, or academics. And what we've seen over the last couple of years in particular is very rarely is someone testing for a single microbe. Generally, the big three
Absolutely.
Bs are in almost every case, where we have Borrelia and various strains of Borrelia. We have Bartonella and various strains of Bartonella, and Babesia. Almost uniformly, we're seeing ticks now testing with multiple microbes as well. So, going back to the conversation we were having before with education, with proper education, folks will have a substantially greater chance of protecting themselves from these infections because there are many steps you can take after you have contact with the tick. But I think the most important step in that process is awareness, right? Because if you are aware of how ticks ultimately grab you, crawl on you, find a spot to bite you. I mean, if you're aware of that and your reticular activation system is triggered, you're substantially more likely to find it. And Matt often calls me the tick magnet because I find ticks on me all the time, but I'm not a tick magnet. I'm a finding magnet. I've lived in a tick endemic community. I had a very aggressive parent who made sure we tick checked all the time from my young childhood, and I'm constantly aware of anything on my skin because that has been something that that was a part of my culture with this aggressive Italian American mother who was on top of us because we lived in a tick endemic community from my young childhood. So
Great.
education is really important. So, and again, thank you now for adding the sexual transmission piece. Again, another thing that has to be studied in more detail. But there's a fair amount of early research that's suggesting that in most cases, when one partner has Lyme disease and they're testing that partner's either sperm or vaginal fluids, the other partner also has Lyme disease or at least the bacteria in their vaginal fluids or sperm. And there's been some debate about whether or not it's being transmitted or not. And I think the leading expert who has questioned that was Dr. Fallon in his book, where he suggested the reason both partners are likely to have been infected is not because they're transmitting it back and forth, but because they're both living in a tick endemic community and they're both being bitten by ticks, and that's why they're harboring the bacteria. So again, I'm not saying I'm not siding one way or the other on this. I think we certainly need to do more research on it, but I think
for sure.
I
It's great that they're sorry. Go ahead.
Yeah, no, but it's certainly important that some of the preliminary testing is being done, and there's certain another one of the things we've shared in the past is when we interviewed Dr. McDonald, he has shared with us that it's at least been definitively proven that Lyme disease will be transmitted between dogs who are sexual partners, whether or not that a separate species study is something that is instructive in humans is a separate question. But we're getting closer and closer to getting answers here, and in the spirit of sort of rounding out the conversation about congenital Lyme, practice engaging in safe sex practices when you are partnering with someone who is breastfeeding is something else that you have to strongly consider when you live in a tick endemic community, right? Because even if you get a negative test, doesn't necessarily mean you're not harboring the bacteria, right? I mean, because the testing is not really very good. So I think in the spirit of being as cautious as we can, perhaps some safe sex practices when you're sexually active with a breastfeeding mother is something that has to be considered by folks.
Yeah, absolutely. I wanted to just hit on a point that I also wrote down previous to some of our conversations around the hormone shifting is my first doctor, like I said, was an OB-GYN doctor, and he stopped my period during Lyme treatment because it is a Lyme flare. And I also wanted to touch on hormones to mention that all of my children suffered greatly before puberty who had Lyme disease. And that's again hitting on our conversation today to the importance of following hormone fluctuation and helping people be comfortable through treatment. Expect a flare for either sex before puberty. They need to be, of course, tested and treated properly because the suffering is horrendous. But I had 2 out of 4 of our kiddos. Yeah, 2 out of 4 of our kiddos needed special signing off from the principal because they missed over 30 days of school in the 5th grade. So always the 5th grade. So look for that. So before 5th grade, people, please check your kids and your families and make sure that everybody is going into puberty healthy. But also, when you're going to treat, I'm not recommending stopping periods, but that's what my OB-GYN of 30 years Lyme doctor did. So I wanted to mention that. Also, I know, Matt, you may have a couple of questions to round this out as well, but I don't want to fail to mention how important people need to hear the critical need in the Lyme community to step up and be a self advocate for yourselves and your families, but pay it forward once you get well. I don't need to be in this space anymore, thank God, but I stick around through being the Texas state lead for Center for Lyme Action. Please go to centerforlymeaction.org and sign up for their newsletter so that you can get on board with hearing new news of when to show up for yourselves. I find in Texas in particular that we don't get a lot of support when it comes to legislative help. So people can do a lot of good to help more people than just their own household by getting involved when you first find out about all of this. I know it's very overwhelming for people out there, but the best thing you can do to have your ear to the ground and hear about these new tests and treatment and so forth is to sign up for advocating. Center for Lyme Action is really great. That's a federal lobbying group, as you well know, guys. But also, we have a new program. I'm an ILADS ambassador. I only put my own companies in my name here on Zoom, but within the bio, I think you'll probably post the links for people to get active. But I would like to encourage everyone out there to get involved as an ILADS ambassador. The application is on their website. Also in ILADS, they are doing this new program where if you have a physician that wants to get more information about Lyme disease or to get their CMEs in tick-borne illness, ILADS, there's an area on their website where you can request that information and they'll actually mail the physician a packet, educational packet. So we're really stepping it up in the Lyme community with getting awareness out there about the importance. It's critical that we have more researchers get into tick-borne diseases, as well as more medical care providers to get qualified education and that qualification that you're an LLMD. So a lot of people just kind of threw that around, you know, as a medical care provider, but that means that you actually go through the in-person educational components to get your level 1, level 2, and so on, and stay up to date with research through these different, like ILADS is a really good one in particular. At Texas Lyme Alliance, we try to keep our website up to date on different things, but also Center for Lyme Action. So, and then also lastly, I have created an integrative Lyme coaching program. I went back to school at 50 and got health and wellness coaching certification, and I really enjoy working with families to pass along the education and information that I've been fortunate enough to obtain. Went to Germany for stem cells and a Lyme clinic there, and just I've done a ton of ozone and a lot of different integrative things that there's no one. Everybody wants to not show up for advocacy work, but they want one treatment to, you know, what's the latest treatment, and it's backwards actually. If you sign up to advocate for yourself, you learn about the latest treatments because there's never one treatment that fits all. So keeping your ear to the ground, reading the research, looking up the words when it's flying past your head as a doctor mom or a Google, you know, doctor they call them, but it's very important to stay involved and just to encourage people. Self-advocacy can't be any more important than protecting your health by learning the cutting edge treatments and legislative work and federal funding efforts that we're all doing to help you at home advocate for your families and get that medical care that people deserve. And it's through the signing up for advocacy work that I was able to get myself and my family in remission.
So Kristina, that was a awesome narrative. So we're going to put all those links in the show notes. We appreciate all your feedback. I do just want to ask, how can people work with you if they want to? So we're going to put the link in the show note, but if somebody wants to work with you, either A, in your integrative Lyme coach capacity, or B, partner with you from the Texas Lyme Alliance Association, how do they do that?
Yeah, thank you for asking. So they can go to my website at txlymealliance.org. And then across this is join us and become an advocate. They can sign up there and see what I need help with, and then sign up for the newsletter. And then the other is on that website, all the way over is a tab, main header called MD and Patient Support. I have a bunch of different subheaders that pop up. One is integrative coaching. They can click there and read about what I do and how I work. There is at the bottom a questionnaire for communicating your health history, and first appointment is free. And then to the right, underneath my picture and certificate, is my Calendly link. It says we respect your privacy, and it's kind of a small deal, so it's kind of obscure, but click that and people can book my first free and see my calendar. And then after that I charge, of course, but I did it for free for 1.5 years, and I just got too busy, and I can't once I've paid for my education, my continuing education, I do charge. So
Kristina, we can't thank you enough for joining our Tick Bootcamp podcast. Let's continue to work together and partner together. We'd love to work with you on all things Lyme and pregnancy, congenital Lyme. You taught us more than anybody ever on this podcast, and you are for sure the leader in that space. And we want to partner with you and help you in any way that we can. Together we can make real change. And again, to answer the question, to kind of bring it full circle, why we are so hopeful at Tick Bootcamp, it's people like you, Kristina. So thank you again for joining our podcast. We are so blessed to have had you on.
thank you so much. It's my honor. I'm happy to do it, and I really appreciate what you guys are doing, getting the word out there from all these experts, and hearing stories like ours. I advocate, and I continue to, because we're well. I didn't do a lot of posting when we were sick because no one wants to hear woe's me, but they do like a success story. They like that Rocky story of jogging up the stairs and arms overhead. A success story is selling advocacy faster than honey on biscuits, is what I would say from the Midwest. So I really appreciate you guys giving me this honor and being on your podcast today, and look forward to continuing partnerships and building for our Lyme community. And keep going out there, families. There's so much great stuff going on out in the community in this space right now. So don't give up, and just keep learning. Keep learning. Turn infection into action is the mindset that I like to pass forward. So keep going out there, and I really appreciate you guys, and hope that you guys keep doing what you do too. It's very important.